Welcome. This is just a brief update. I've been thinking about Australia, and it's very frustrating to watch Australia, to be quite honest, because it's done so well for 18, 19 months now. And then all of a sudden, when the vaccination program is already in train, the Delta variant arrives. And let's just look at that from this graph. So New South Wales, 136 cases in the last 24 hours. Now, that doesn't sound like a lot, but of course, this is going up from very low, basically non-existent numbers in Australia. These numbers here were just in quarantine, so this was contained. But we see, basically, we're starting from about the early July, end of June. We start, that's the 23rd, 21st of June there. We started getting a few cases, and it's just gone up, I'm afraid, really quite dramatically, indicating community spread in Australia. I mean, this is mostly in the Greater Sydney area, in New South Wales, and that's where the real problem is. And we see this dotted line here as the number of tests. So the testing is fairly good. So this is going to be a fairly accurate representation of where we are. So really very frustrating indeed for Australia. New Zealand, of course, has suspended the flight bubble. There were flight bubbles between Australia and New Zealand. That's now suspended. Now, there's quite a lot of calls, basically, to put a sort of a seal around the Greater Sydney area. And in Australia, this could well be done. I mean, for example, Tasmania is completely cut off now. Western Australia has imposed a hard border all the way around it. I mean, if anything, Australia reminds me it's a bit like a ship. If one compartment floods, they're able to seal off the rest of it. So I wouldn't expect cases to go up in Western Australia or Tasmania, for example. But New South Wales, Victoria, and even Queensland, we can probably expect to see some more cases. In South Australia, there's some as well. So that's the Delta variant, just so much more transmissible. Now, Israel. Now, this is quite perturbing, actually, from Israel, quite what is going on here in Israel. Now, the cases in Israel are now back up to 1,700, roughly 1,700 per day, and they're bringing back the green pass to get into quite a few venues. So we see cases coming back in Israel, despite the relatively high vaccination status of the country. So Israel's health ministry, 20th of June to the 17th of July. Now, this was the time, this is when they've got the data from here, 20th of June to the 17th of July. It's now the 23rd of July still. This was the time when the Delta variant was spreading in Israel. And of course, Israel is virtually exclusively vaccinated with the Pfizer vaccine. The vast majority of the vaccinations in Israel were with the Pfizer vaccine. And Pfizer's vaccine's efficacy in preventing Delta variant infections in Israel is found to be 39%. Now, we have been seeing efficacy figures in the UK of about 33, 34, 35, 36% for one dose. But here, after two doses in Israel, it's down to 39%. Now, this is hard to understand because it's the same Pfizer vaccine and it's the same Delta variant. We know that from genomic analyses. So is it that the immunity in Israel is waning to the Pfizer vaccine? Because we'd expected a good longevity of the immune response, and this really is the concern. Now, it is well worth noting that still 91% effective in preventing serious illness. So that's, you do see slightly different figures, but so we've got about 91% efficacy in preventing serious illness and hospitalizations. But the risk of getting infection is not reduced. It's a 39% level of protection. It's a low level of efficacy. It's way lower than it has been, indicating that the infection is coming back because, of course, Israel was one of the earliest countries to vaccinate. So while we saw the beneficial effects coming in Israel first, it also follows that we could see any waning off effect of the vaccine happening in Israel first, and this does seem to be happening. So let's look at that now. So this is again from the Israeli Ministry of Health. I've posted the link there. Decreased potency of the vaccination against transmission. So this first cases we were looking at here was Pfizer's vaccine efficiency in preventing Delta variant infections. So that seems to be going down. And now preventing infections seems to be going down, the transmissibility. And of course, because the transmissibility is going up, that's why the cases in Israel have gone up to about 1,700 per day and still appearing to rise. Now, decreasing potency of the vaccination against transmission. For those vaccinated in January, the decreased potency of the vaccination against infection is now down to 16% against transmission. So they're still really almost as likely, well, it's 84% as likely to transmit the virus as someone who's not vaccinated. February, it's 44% protection against transmission. People that were vaccinated in February, 44% protection. People that were vaccinated in March, 67%. People that were vaccinated in April, 75%. So we see a clear reduction there, unfortunately. So 16% protected from the January cohort, 44 from the February cohort, 67 from the March cohort, but 75% protection from the April cohort. And of course, in terms of protection against infection, this is roughly what we're enjoying in the UK at the moment, roughly. Now, the protection against severe illness is given, the most recent figure is 86%. So that is down a bit from the 91%, but it's kind of a reasonable margin of error, really. So we're still getting 86, 87, 88, 90, 91% protection against serious illness. But the protection against transmitting the virus has really reduced quite dramatically. Now, what do we make of this and what would we expect? Well, I'm expecting the individual's immunity against serious disease to be quite long-lived. But this is indicating that people are getting the virus. They are producing reasonable amounts of the virus, which is making them more transmissible. And it's looking like the infections from people that were vaccinated longer ago are suffering from higher viral loads. Now, more to come on this, but it really is quite a perturbing reduction in the protection that the vaccine is giving us against ongoing transmission. And we've seen other, as we've just mentioned, other protections coming in Israel already. So we'll keep an eye on Israel. That's kind of leading the way. Where Israel is now, we could well be in a few months' time. But this really does make it much more likely now that booster doses of the vaccine will be needed to keep up the reduction in transmission. Now, when more people are infected, and this is combined with natural immunity, it's hard to say what's going to happen, but that level of waning off, I must say, does surprise me, and I don't pretend to be happy about it at all. So we'll keep an eye on that from Israel. More data we expect coming out soon from Israel. Now, other parts of the world, we've looked at quite a few regions lately. I just wanted to have a quick look at sort of Southeast Asia region. And we'll look at it here. So now Vietnam did so well. Again, very frustrating to watch. Vietnam did so well for such a long time, but it's not it's not the measures that we're working against the more transmissible Delta variant with the higher viral loads that is generating. So you might remember these cases started in Ho Chi Minh City. There was a cluster there. Well, it's now increasing away from Ho Chi Minh City. So that is the situation in Vietnam going up. Now, Myanmar, the country that was Burma. Now, we believe that the cases in Myanmar are really remarkably high at the moment. In fact, we know that the cases are remarkably high at the moment. We know people are dying through lack of oxygen in basic facilities because of the political unrest and the military dictatorship that they're currently suffering from under. So the cases in Myanmar are actually probably the highest of this group. It's simply that is not being reported at the moment. I left the United States in there for comparison, but we can see the increase in the United States, which we looked at on the previous video. Indonesia, increasing cases. Thailand, well, there appears to be a reduction there, but I don't know if that's genuine yet. And Malaysia is showing the highest number of this cohort of countries at the moment. But when we look at the new daily COVID-19 tests, we see that Malaysia is testing more. Having said that, the United States testing's gone down quite a lot lately. But we see Myanmar with very low levels of testing, then Indonesia, Vietnam and Thailand. So these countries have actually probably got quite a lot higher rates than are being shown here. And the country that I'm probably most concerned about there, well, Myanmar, of course, people are dying there now, but Indonesia, potential for rapid increase in Indonesia. Actually, it's Indonesia that's showing a slight reduction there, but as far as we know, that is not a genuine reduction. And the number of cases, as we see, have just dropped off in Indonesia as well, which could potentially explain that. When we think about vaccination, COVID-19 vaccine doses per 100 people, well, the United States, Malaysia going up quite nicely, but of course they're going to take some time to kick in. Vietnam, Myanmar, we don't even have data. Basically, that's plunged down to almost nothing now in Myanmar, unfortunately. We're in a few tens of thousands of vaccines for the whole country in Myanmar. Thailand, Indonesia are also relatively low, indicating we haven't got a good level of immunity growing through vaccination in those countries. So certainly an area of concern in Southeast Asia. So not particularly good news so far, I'm afraid. Now, I've had an email from David in New Zealand. And this is his letter here. No, so this is from the Ministry of Health. I'll just read it out, I think. So basically, David wrote to the Ministry of Health in New Zealand and said, why the heck are we not aspirating before we give our vaccines? And we've asked this via various intermediates to governments around the world, and they almost don't seem to understand the question. Because if you don't aspirate, you've got the potential for inadvertent intravascular administration. All you've got to do is stick the needle in, draw back to see if you've got blood. And we don't do that. That's not being done hardly anywhere. So this is the position in New Zealand. Thank you for your email to the Ministry of Health in regards to the technique of administering the COVID-19 vaccine. I have been advised that during the training for COVID-19 vaccinators, does not advise to aspirate prior to administration of the vaccine. Well, we know that. This training aligns with the current best practice recommendations from and the World Health Organization guidelines. The team are continuously reviewing evidence and guidelines to make adjustments and update appropriately. Well, there's no sign of that, is there? I have forwarded your clip, that's of one of my videos, for their information. And that's from the Ministry of Health. COVID-19 response and coordination team. So basically, I mean, that is the response that David got. I mean, it basically means they haven't thought about it and they've just sent out that condescending reply. At least I got a slightly more detailed letter from Nadeem Sahawi. But again, the result was no change. Why not get rid of this variable in case this is causing some of the vaccine side effects? Okay, so that's us for that. That was just a brief update because the last video got a bit long. So if you watched this as well, thank you for watching.